This podcast is for educational and informational purposes only. It should not be used to substitute the advice from your medical professional or primary care provider. If you are having any kind of medical issue or emergency, you should call 911 or go to your nearest emergency room, urgent care center, or consult with your doctor. Welcome to
Healthcare Snitches. Hello, everybody. Welcome to Healthcare Snitches.
Welcome to what we think is episode 14, hopefully. But in the event that it's not, please don't hold it against us because we just don't know at this point.
I have no idea.
Right. All right. So this episode is fun. It's about sexual health. Woo, child.
I'm sure you can all relate to that.
Yeah. So we're going to go through some stats on the different types of STDs, the most common ones, and some ways to, like some symptoms, some ways to prevent getting them, some ways to test for them, when you should test for them, and also what you should do going forward. Okay? Before we jump into that, though, I want to remind you guys to like and subscribe to our YouTube channel, so Healthcare Snitches. Also follow us on social media, Instagram, TikTok, Facebook, and on YouTube. Make sure that you turn on your notifications so that you get notified when we post new episodes every other week.
Every other Sunday, guys.
Yep. Ooh. Every other Sunday.
Oh. Do you know what the most common STD is?
I'm gonna go with Clemmy.
Yep, chlamydia is the most common. Well, it's the most reported STD in the U.S. And what a lot of you guys may not know, I mean, I learned this early on when one of my friends had...
Girl.
No? Okay.
We're not doing that.
Okay. I learned it early on.
And when she says one of her friends, she ain't talking about me. I just want to make that very clear. I'm just saying.
I was in my early 20s. Okay. I didn't know you yet.
Well, according to you, you know me
since kindergarten.
Right.
But this person had chlamydia and gonorrhea. So what you guys need to understand is that chlamydia and gonorrhea is like peanut butter and jelly. Bacon, egg, and cheese. Turkey and cheese. They roll
ham
together.
And Swiss. Peaches and herb.
Swiss? Who eats Swiss cheese?
Mice? I don't know. Caucasian people?
They roll together. So if you test positive for chlamydia, you might have some gonorrhea up in that cooch as well.
Yeah, they cousins.
Yes, they are BFFs. They roll together, honey. So a lot of the symptoms are pretty similar. It's mostly spread through vaginal and anal sex, but it can also be spread through oral sex too. So a lot of you people out here on your knees thinking that you're safe, you are absolutely not safe. I promise you, you are not. So you might notice some discharge from the penis or from the vagina, or it can cause burning and pain when you urinate. Everybody who have burning and pain when they urinate, you may not have chlamydia or gonorrhea. You could have a UTI.
Yeah, you could.
Yeah.
But if it's...
What was I saying?
I feel like if it's persistent... So I feel like the reason why a lot of these cases are reported is because people have those symptoms and then they can't take it anymore. So they end up going to the doctor and being like, look, this is... when I go to pee, it burns.
Yeah.
Are there any, like, does your urine look any different? Because I know with the UTI, normally your urine is like is cloudy.
That's not one of the reported symptoms.
Yeah, I never heard that either.
I don't think so.
I haven't. I've also heard that with these two, you can have a different kind of discharge. So.
Oh yeah, they actually called it odd. That is what they said, an odd discharge. So. I don't know if that's odorous. If it could be both, odorous, or it could be like green and yellowish, maybe.
Yep.
I don't know. But what you guys need to know is that you cannot take a cranberry pill to cure this.
Right.
It's a form of bacteria, so you have to treat it with antibiotics. It can be cured, but you need antibiotics. Don't use no old penicillin that you have in your fridge.
Right. Refer back to the medication episode, okay?
Yes, you need to go to the doctor.
Also, don't be trying to take herbs and stuff from Dr. Sebi or whoever,
or from
thinking
TikTok, like you said,
right,
TikTok.
thinking that it's going to help you out, it's going to cure the no.
Yeah.
No.
You have to go and get treated by a doctor or by a nurse practitioner, somebody who has a prescription pad where they can write you a prescription.
Right.
And then also, whoever your partner or partners are, you need to report this to them because they too need to be tested and possibly treated.
Mm-hmm.
Don't do anything crazy like while y'all both on antibiotics, y'all out here in these streets getting freaky unprotected.
Right, because you feel like, well, we already got it, so might as well get super gonorrhea, which is something that can happen. So don't go do that.
Yeah, don't do that. And then what you also need to know is within 1 to 3 months after you are treated, you should be retested. Why? Because if you're doing something foolish, like hopping back in the bed with them, doing what Jasmine said, we already got it, what's going to happen to us? Don't do it to yourself. So make sure that you are retested. Wait, did I say retreated last time?
No, you said retested. I feel like, oh.
Well, if I said retreated, that's not what I meant. I meant to say retested.
So some quick stats that were published in January of 2024. They're from 2022, so just be mindful that that's kind of outdated, but there's more recent data from 2024, which is kind of on point with the 2022 data. A little bit more alarming, okay, because I don't know what y'all are out in these streets doing. But in 2022, there were more than 2.5 million cases of syphilis, gonorrhea, and chlamydia reported in the United States.
We nasty here.
We nasty. Gonorrhea cases declined for the first time in at least a decade, though. So that is a bright spot within that data. Now, I was very curious to look into this and kind of research it, and I haven't had the time to really dig deeper, but I was curious to see what was happening post-COVID, because I feel like there was the time frame when we had the lockdown where I feel like people couldn't really get out, but maybe they were making some stuff happen. If they could meet up with someone real quick, just go to their house, because you could go to someone's house. Nobody was stopping you from going to anybody's house. But I think everyone was so scared of getting COVID that it kind of stopped everyone from doing that.
So you think that their numbers may have declined?
They did a little bit, or they at least stayed a little bit stable. Because when we look at the 2022 data between the earlier months in 2020, there was a decline, and that is because folks were forced to be locked down,
or folks went on home to glory.
Or they went on home to glory. But for the age range that typically gets these diseases, which is between 18 and 24, they weren't really going to glory.
They were. People were dying.
They were, but not 18 to 24. They was getting gonorrhea, syphilis, and chlamydia, okay? Or not, right? Because they were staying home with their pop and their mom and their dad. Who was dying. Exactly. And so because
COVID back to them,
exactly, and because they were locked down, they were not transmitting it as easily, or they were just staying with whoever they was with and just getting it in there. And there's no way, I feel like cheating does contribute to these numbers too.
Big time.
So what I feel like happened in 2022 was that, all right, 2020, the end of 2020, 2021, all them bans were lifted. People started getting a little bit more free. And everyone started to feel like, I only got one life to live. COVID, YOLO, let's do this. And again, I was married during these times, so I wouldn't know. But the feel that I got from social media was that there was a lot of, just from the narratives that were floating around, there was a lot of sex going on, which, whatever. But also that it was, unprotected, too. Because just, again, some of the narratives, I'm like, well, how would you know unless you're doing this unprotected?
Can you give me an example of one of the, just of a narrative? How do you figure that it was unprotected?
Well, I haven't looked into the statistics of the pregnancies, but I'm pretty sure there were a lot of those.
Yeah, true.
So if you're having a lot of pregnancies, you're definitely having a lot of unprotected sex.
That's true.
I don't know about 2021, but 2023 at least. When I started to get out there and like be on apps and stuff, I definitely was approached in ways where I'm like,
oh yeah, the way
whoa.
you were being approached
Right.
was ridiculous.
Whoa. Like, I don't.
Hi, my name is Jonathan. Do you like your nipple squeezed?
Right. And that is keeping it lightly. It was more so.
I'm being kind.
Right. So just like she said, you can get this from having unprotected, genital sex, but also oral sex as well. I saw something today where it was like, oh, this prison inmate got gonorrhea in his throat, and he didn't even know that was a thing.
Child.
But yeah,
tell me he's married and his wife is coming up there for visits, and he got it from her because she in these streets while he's in jail. Please don't tell me he was in there.
Ooh, no, that's a whole nother episode probably for STDs in
prison,
controlled populations like that, or situations like prisons and
and we can include
colleges,
the correction officers in those statistics.
Oh, absolutely,
as well.
Absolutely, prisons, jails, colleges. Because I came across the top colleges.
Assisted living,
yes.
Granny be getting it in.
Yeah, walking in. I know, right? They ain't got no teeth. So
hands on your knees. Hands on your knees.
You're already down there. Might as well. So in those controlled situations, everybody's doing everything with everyone, so it gets spread easier, which is a thing.
Ooh, child.
I know.
All right, so that's chlamydia, gonorrhea. Ooh, HPV. So, I mean, okay. So it says this is from WebMD. I trust WebMD,
even though they be telling me you won't die.
Yes, I trust them. So many times I done went on home to glory and came back.
Right. Yeah. False alarm.
I trust WebMD. I don't know what to tell y'all. Y'all don't judge me. But they said nearly every sexually active person will have HPV at some point in their life. And you know what? They are not lying. They are absolutely not lying. I remember when my mother died, and she died in September. October, I was due for my pap smear. And I went for my pap smear, and it came back abnormal. And I was like, oh, Lord, I got HPV. I'm going to die from cervical cancer. It ended up being that my test was abnormal because of cervicitis. I had inflammation of the cervix.
Okay.
So,
That's really funny.
So, but you stupid. But I was so afraid. I was like, I just watched my mother go through chemo and die, and now it's going to happen to me. So, there are nearly over 200 strains of the HPV virus, and 40 of them can be spread sexually. So keep that in mind. I don't know what the percentage is because I'm bad with
So the other 160, how we getting it?
Well, you can get it from skin to skin contact as well.
See, that's why you can't even touch nobody.
You can get it from skin to skin contact.
No,
and what I realized, what I researched is a lot of these strains will cause no problems whatsoever. You'll go for women. You'll get a pap. It'll come back abnormal. They'll see that it's HPV. You may have to get a cone biopsy or something done, and it will disappear on its own. They'll tell you to come back in like 6 months for another pap. It will disappear. You won't have any issues. It will go away on its own. Others are not so friendly.
Right. So I feel like, one other thing before we talk about the others is that men usually carry this, but there's no way for them to be tested for it. So that is...
And it's easy for them to pass it.
And it's very easy for them to pass it.
And lots of times they don't have symptoms either.
They don't.
So they don't know that there's something going on.
They don't have any symptoms. It doesn't impact them the way it impacts us. So some of those forms, I don't know how many you have it in there, can be the cancer. You said 40.
Cancerous or
type.
Genital warts.
Or genital warts.
Those are the two.
Okay.
It can lean toward genital warts, or it can lean toward cancer. So you can get cervical cancer, throat cancer, oral cancer, or penile cancer.
Oh, fun.
Yeah. So there's this HPV vaccine. There's only one.
Gardasil.
And yep, it's called the Gardasil 9. And the reason why it's the number 9 behind it is because it protects you against 9 strains. So
what about the other 31?
What about the other 31 or the other 191?
I don't care about.
You don't care about the ones that will disappear?
Yeah.
You just on your own.
They said.
So, the CDC recommends that young women and young men between the ages of 11 and 26 get vaccinated, but more recently they have approved it for women up to 45 years old. So that's why I was telling Jasmine earlier that she should get vaccinated as well. I spoke to my gynecologist about it. He wasn't rolling with me.
Yeah, I'm gonna have to change gynecologists anyway, so maybe at that time.
Happiness.
I haven't either. It's
such
an intimate thing where it's like you want to find someone that you're comfortable with, and I feel like the recommendation that he made to you because you're married is very outdated.
It is because
like
people cheat in marriages all the time.
Yeah, so you should still be getting tested and making.
Well, he tests me for it every time.
Precautions,
but
against things.
That makes no sense, right? You're testing me for it, but yet you're telling me I shouldn't get it because I'm in a committed marriage.
Yeah.
So why are you testing me for it?
Yeah,
I miss the guy who delivered Corey, Dr. Holgado, Dr. Caesar Holgado. He doesn't take my insurance. And he does do out of network benefits, but then I got to come out of my pocket like $400 or $500. I'm not doing that.
Nobody's doing that. To do something that you don't even want to do
just to get my cooch papped and smeared.
Right. Thank you. I don't even want to do this. Now I got to do this. I got to pay for it. I got to pay you to hurt me. No, thank you. But there are certain kinds of HPV that do cause like precancerous dysplasia.
Yeah, so that's what happens when your test comes back abnormal. So it can be mild dysplasia, which will 9 times out of 10 disappear on its own. But if it's moderate or severe, you're gonna need a cone biopsy or a procedure, maybe.
Yeah, so usually what they do is they do the cone biopsy when it comes back abnormal, depending on whether it's mild, moderate, whatever, and then they'll tell you if it's like what they saw from it, if it's cancerous or if it's just benign. And if it's bad enough, you may have to get something called a LEAP procedure.
Oh, yeah.
Where they scrape the insides out and burn them out. Scrape and burn? I don't know what they do.
A lot of doctors are going away from that.
Okay.
And from cone biopsies because they are linking it with miscarriages.
Probably because now you're weakening the walls. And if I want to have kids after this.
Yeah, they've been trying to.
How am I going to hold it?
But it's like you got to pick the best of the bad.
Because, like, how am I having kids if I have cancer?
If
like,
I'm dying.
Yeah, I'm saying, like.
Yeah.
Yeah, make it make sense for us. So, that's HPV. It's,
what's that guy? That famous guy that has throat cancer? I want to say De Janeiro.
Michael Douglas.
Oh, is it? I knew it started with
not
a D.
De Janeiro. You done made him all types of Italian.
I wonder if he has throat cancer because he was in these
That's
streets.
What they said.
He was in these streets, hands on his knees, and he done swallowed something that wasn't supposed to be swallowed too many times.
I mean, that's what they said. I mean, that's what he said. Somebody
so
said
his is HPV based?
I believe that's what they said, yeah.
Gotta be careful, y'all. Gotta be careful who you are eating and who you are sucking. All right. Do you have any stats on the HPV?
No.
Okay. All right. So the next one is what Jasmine and I like to call herpes.
I get it. It's the designer form
of herpes, but we like to call it herpes with a hyphen after the S. Okay, herpes.
No, with a
apostrophe.
Yeah.
Sorry, hyphen is this.
Yeah.
Apostrophe.
Yeah.
Okay, so herpes, you can get herpes through HSV1 or HSV2, but the culprit is usually HSV2. Herpes simplex virus is the HSV. Roll with me.
So isn't her HSV1 oral?
Don't make me lie.
And then HSV2 is genital.
Don't make me lie.
Oh,
I'm
okay.
not sure.
I didn't know whether you had it in your notes, so
Mm-mm.
that's why I said it like that. But yes, HSV1 are the cold sores that you usually see on people's lips, right? So if someone has like a pimple above their lip or like on their face, that's not herpes. It's usually a cluster of bumps. It very clearly looks like herpes, and it's usually on their lip.
But how about those people that have one blister on their lip? You know that they have the herpes simplex virus.
That's HSV1. That's oral.
So the cluster, that's what we were.
And sometimes they have the cluster on their lip.
That's what we were seeing. Ooh,
yeah.
My skin is crawling.
Yeah.
That's how we were able to diagnose it. So
yes.
Not us. We didn't see it on us.
On someone
else.
Yeah.
We were advocating back then because we
said
you need to go to the doctor because we are positive that this is herpes.
Yeah.
And they went to the doctor and it was herpes.
Mm-hmm.
And even the doctor saw it and said, "This is herpes." But I'll do
Before the test
I'll do a culture of it, but
right.
It's definitely herpes.
Yeah.
Ooh, child. Ooh. That we could have charged for that.
Mm-hmm.
So you may get blisters inside your vagina or your anus.
That sounds like it hurts.
Where you can't see or feel it. And not everyone who has herpes has blisters. That's really scary. Not everyone who has it. It's very easy to catch. It can be transferred skin to skin. Mm-hmm. So let's say that you have on a condom. Okay, the condom is fine. But let's say that they have a blister on like the pelvic area and it rubs up against you. Mm-hmm. Cram! You got herpes.
Let's say they have a blister on their thigh. Cram. Herpes. Let's say they have it on their chin.
Oh, that's where it was at.
Herpes.
Cram. Yeah, so it can be skin to skin. So when you hugging somebody and they got herpes right here and you touch right there, cram.
A lot of moms pass it to their children during childbirth. So it is common to get tested for these things while you're pregnant so that you can be on the antivirals to prevent an outbreak if you want to have a vaginal delivery.
Accurate. So you're most contagious when the blisters are present, but keep in mind, it can still be transferable without the blisters present, but it's just more contagious while they are present. So pretty much, I'm going to say that again. There may be no blisters at all. You may not see anything. It does not mean that Rasheen did not give you herpes.
I can't.
Just because you didn't see anything. If there are blisters present, it is easier to pass the peas like we used to do.
Right, and be like, no, thank you.
But it's still contagious, even if there's no blisters present.
I think the tricky thing about herpes too is, and we're going to talk about this a little bit later, but let's just say you are in these streets and you're trying to be proactive about your health. And so you ask the person that you want to be intimate with, hey, show me your paperwork. And then they show it to you and it's really the standard panel for STDs. That usually, unless they ask for it, doesn't really include herpes, because a lot of times people only get tested for herpes if they have a symptom. So then if you don't have any of the blisters, if you don't have a symptom, sometimes it can stay dormant until something stresses you out and then you have an outbreak.
Stress can cause an outbreak. Chocolate can cause an outbreak. Shut your mouth. Chocolate. Eating too much chocolate. I don't know what it is in the chocolate.
That sounds like sugar. A sugar issue.
But why is it just chocolate?
That person don't know. That person's stupid. So, oh, I'm sorry.
I hope you don't watch this.
I don't know the person, but whoever that is, that don't make no sense. I mean, it could make sense.
I'm going to look it up when we're done.
Okay.
But yes, certain things can definitely induce an outbreak.
And then that's when you'll know you have it. But if it lays dormant or if you never have an outbreak before then, you think you're good unless you get tested. And I actually don't even know if you get tested if it's not flowing through your veins,
Like
if it will show up.
Like if it's not present,
Yeah, I think it still will, right? Because it's looking for the presence. So when you're looking for things like herpes and HIV, you're actually looking for the presence of, well, there's different types of tests, but one of the tests is actually looking for antibodies, which are, and don't get me to lying, but the things that show up to fight the virus off,
as opposed to what antibodies are.
Okay, as opposed to the actual, like they're not looking for the presence of the virus, they're looking for the things that fight the virus.
Yeah, they want to see who all over there,
right?
Who outside?
Yeah, and so usually they look for that, and then other types of tests look for the actual presence of the virus replicating itself.
And there's a panel for certain tests, like she just said. There's a panel, so it won't just be am I HIV positive or not. There's a whole panel of tests that they look at. So, and remember, HIV and also herpes cannot be cured. Once you have this for the rest of your life. It can just be treated. You can be on medication to help keep it,
right.
Well, for HIV, they have meds that make it undetectable, right?
Yeah, so if you are taking your meds in accordance with how you should be taking them, then your viral load typically goes down to an undetectable state, which means that there's so little of the virus within your blood that it can't be transmitted, right? So part of, I don't think that's the case with herpes. No, I would have to look it up.
It's not.
Because even if you are taking the Valtrex, I think that it just suppresses the symptoms and kind of manages your viral load, but it doesn't get it to the point where you can't transmit it.
It's not undetectable, and you can always transmit it.
Yeah, so that's the difference there, but they kind of function similarly in the sense that they're treatable, they're not curable. So you're just managing the symptoms.
That's it.
Yeah.
And that's awful. That's an awful way to have to live your life, because now if you are not married and if you are single, everyone that you are going to be even just kissing, you need to let them know exactly what is going on. You need to let them know that you have herpes, because you have to put the ball in their court and see if they're comfortable kissing someone with herpes, see if they're comfortable dating someone with herpes. So you should be a good person, and it's criminal.
It is. In most states, it is criminal not to disclose the information if you are going to be participating in activities that could potentially expose them to the disease. I know it's really a hot topic with HIV. I'm not sure about herpes. You would have to look into your own state laws about that. But if someone knowingly transmits it or participates in activities where it can be transmitted, so for HIV it could be having unsafe sex or sharing needles, then they can be criminally prosecuted for doing that.
As they should be. How awful of a person are you? Like, I don't even remember the guy's name, but I saw it last year on Facebook. He was fine as I don't know what, and he was just out here in these streets sleeping with women, passing HIV to them. Just ruining lives.
And he knew he had it?
And he was something cute.
See, that's the other thing about herpes, right? Not herpes, HIV. You can't tell who all over there. You can't tell who got it. I mean, if you feel like you can, I'm going to tell you, you can't, okay? And so you can't just go based off of how someone looks, how well they talk, how well they dress, if they're clean, whatever. Because for some reason there's this association with, like, if you're dirty looking, then you have, no, it has nothing to do with that. You cannot go based off of that. Like, all you can go based off of is the test results. And what I'm going to tell you right now is that if you are in these streets, you need to be asking people for their papers, okay? You need to be asking them, when's the last time they got tested? When's the last time they had sex? And then you need to be seeing the results of those tests.
current test. We don't care about nothing from 1984.
Right. We don't care about nothing from 2021. Because we know you've been in the streets since then. So we need something current, right? And if you ask for that and you get a they start moving like Lil' Kim.
Like if they're offended.
Yeah, then you know. What'd you
on.
say, pass the peas like you used to do?
Mm-hmm.
That's what you need to do. Roll up out of there, because if they're not willing to either show you that they've been tested, which is like the best case scenario, or go get tested before y'all
hit the sack.
Right. Then they're probably somebody you don't need to be sleeping with anyway.
Yeah, because they're just not responsible at all.
Go back to I'm gonna go back to these states and cities. Well, one that we didn't really talk about is HIV. So that is, according to the internet streets, the granddaddy, the granddaddy of the STIs, and it is still being spread out here in these streets, y'all. Like, when it first hit the streets, everybody considered it to be a gay man's disease, and shame on them for that. I mean, that is kind of like how it originated, but
what about at least the guys here that were shooting up needles?
Right, but then it was then associated with those who were shooting up needles. But then as you have folks that are crossing into different populations, it started to spread to everyone. So really, it should be everyone's concern.
Anyone can get it.
Anyone can get it. And just the same with all these others, you may get symptoms like after your initial infection, but not everybody does. I think for the most part, from TikToks that I've seen and like stories that I've heard, you typically do get at least that initial, once the virus starts replicating in your stream, you do get that initial sickness, but a lot of people pass it off as, oh, I got the flu, or now they're like, oh, I got COVID. Mm-hmm. So it's really hard to distinguish because it looks like a lot of other illnesses that you might get. But typically you do have that initial period where you get sick. And if you are having sex, especially unprotected, you do need to get tested regularly. So you should be getting tested every 3 to 6 months. If you have multiple sexual partners, for those that are in committed relationships, you could do every year, but you should be getting tested regardless, because you just never know what the other person is doing, and you don't want to be so naive to think, oh, they would never do that. No, get tested still, because you just don't know.
Yeah.
Speaking of not knowing, I'm gonna tell y'all some facts about some states that are up there having the highest STD rates. Okay.
Oh,
so again, data from 2022 published at the beginning of this year. The top 10 states for STD rates. And you guys can go to the CDC website, or you can Google this, and you'll be able to see the breakdown of chlamydia, syphilis, gonorrhea, and HIV, because those are the ones that are most commonly reported, or that they have to report, I guess. So the number 1 state is Mississippi.
That's crazy.
Number 2 is Louisiana. Number 3 is Georgia. Number 4 is New York.
Of course.
Number 5 is Maryland. Number 6 is South Carolina.
Oh, child.
Number 7 is Florida. Number 8 is North Carolina. Child, maybe I should have moved down there with you. Number 9, I'm up in New Jersey, ain't up here, but number 9 is Nevada, and number 10 is Alabama.
Alabama, they don't have nothing to do down there.
They don't. Now, some important things to note is that these are the top 10 based on per capita. So based on the population, the amount of cases that were reported. So not necessarily just the raw numbers of cases, but just by the population and by the square footage, or the land mass, I should say, whatever. We're having a lot of cases being reported. Like, it shouldn't be that way. And 7 out of the 10 are states that are southern, just to point that out. Keep it up top. I know New York is on here, but Maryland is also on here. But other than that, we keeping it funky over here. Well, not funky. I don't know.
Or maybe we just not going to the doctor.
That too. Honorable mention goes to Texas at number 11. Coming through. New Jersey, I put it in here just because, I'm from there, is at 24, and Pennsylvania is at 28. So, they're on the list. They're not in the top 10 or 11 or, 20 even, but they on there. And Vermont has the lowest rates. And
because don't nobody go there.
Exactly. What you going there for? Cheese? New York is the number 1 state with the highest rate of HIV cases. And California has the largest number of cases reported, but they don't have the largest per capita. So,
okay, just
spit those facts. The top cities. So just in case you're like, oh, I don't never go to Alabama. All right. Well, do you go to Philly? Okay. Because it's number 1.
Philly is number 1
from 2022.
Ooh,
Memphis is number 2. Jackson, Mississippi is number 3. New Orleans is number 4. St. Louis, Missouri, where Nelly was doing his thing, is number 5. Baton Rouge is number 6. So that is 2 for Louisiana. Mm-hmm. Okay, Louisiana, what y'all doing over there? Not just making gumbo, okay? Montgomery, Alabama is number 7. San Francisco, California is number 8. Detroit, Michigan, y'all supposed to be over there making cars and stuff. Not doing this. And then what is number 9? And then Washington, D.C. is number 10. Okay? Ooh, the small dot. So that was from 2022. In 2024, very similar results. The only difference is that for some reason in 2022, Baltimore didn't report any numbers. I guess they were sleeping during that time. Is that they are on the list for 2024, which this just came out. But Memphis is number 1 now. What are y'all doing in Memphis, Tennessee? Y'all getting crazy over there. Jackson, Mississippi is number 2, so still in the top 3. Columbia, South Carolina is number 3.
That's where I was born.
Okay. Baltimore, Maryland is number 4. And then Philly is number 5. So we were kind of talking before this as to why we think the numbers look the way they do, right? And how it's clear. The southern states have an issue going on.
A lot of them are poor.
Yeah.
So I was telling Jasmine, excuse me, a lot of these places have high populations of poor people who really don't have the funds to like go out and do things. So guess what they doing? They staying home and they having sex. That's what they doing. And Billie Jean is having sex with somebody who's having sex with 3 other bodies. It's like obvious.
Yeah, and they all having sex with each other. And so then it's just spreading. And clearly, they may not be able to get to a store to get a condom because it's so far away.
Well, because their car is not dependable and it won't work to drive that far.
Well, they need to start shipping condoms out to, or maybe they are using condoms, but it's so hot that it's deteriorating so quickly and it doesn't even matter. I don't know.
I don't think they're using condoms.
They're not, right? They're just getting it in.
They're making poor decisions.
Okay. I'm glad that they're getting tested and that the cases are being reported. I mean, that is good, which means that hopefully they're getting the treatment that they need, right?
Shirley Ann is going to the doctor when her cooch is not right.
Right. She said, it's burning down there. Get her. That is that a gator? Okay, you should be worried about the gators instead of worried about getting that thing snatched, all right?
You said worry about the gators.
I'm just saying. So they're getting that thing hot and popping down there. But also in doing the research, they said that they don't have access to clinics. A lot of them closed down during COVID and even before then because there are a lot of rural areas. And it's just so far. Like you said, they may not have a car to get there, just like they didn't have the car to get to the condoms.
Social determinants of health.
Social determinants of health.
SDOH.
Right. So if you don't have internet, you probably don't have access to healthcare. You probably don't have access to condoms.
This is very sad.
And, I mean, these people be having a lot of kids, too. So, again, if you having the kids, you having unprotected sex. Somebody is. Somebody's saying that thing. So what excuse does Philly have? I need to understand. They just hot in the pants.
Philly is right there where they are traveling to, to New Jersey. They are traveling to Maryland. They are traveling to New York. They're traveling to DC. They're spreading their little germs and picking up germs from these other places. That's because Philly is like so centralized.
It is.
It's so easy for them to get to all these places. Vermont is far from Philly, so they're not going up there for no cheese.
They not. They going somewhere else for the other kind of cheese that you get when you get one.
That's what Philly's issue is. And we got to keep it real. There's a lot of places which you can speak on because you've lived there. There are a lot of places in Philly that are like the hood. And a lot of hood people don't make good decisions when it comes to sexual health or to finances or to anything else. And that's why New York is number one for the highest rate of HIV because guess what? It's a lot of hoods in New York City as well. And we are not making good decisions either.
We're not. And so if you also are smoking weed, drinking a lot,
you high,
you're not drunk, you
just like, rolling up
right. You like whatever.
You rolling a blunt and then you rolling up in something.
Yeah. Then you're like, let's just whatever. Let's just do this. And I can tell you, that never leads to anything good, okay?
Wait, one last thing. You guys need to realize, because there's a lot of people watching who don't live in the hood, who are very smart, who are educated, who have good jobs, and who are single. You have to make good decisions. 15, 20 minutes of Pound Town is not worth your health. It's not. Now, some of these things you can't prevent. Sometimes you can put on a condom and rub up against Jaquista, and now you got...
Not Jaquista. That sounds like a medication, actually. Take Jaquista.
You stupid. And now you have herpes.
Yeah.
I mean, what are you going to do in that situation? Sometimes you're just an innocent bystander.
You fought the good fight. You tried. But I will also add that, and even though it gets tricky because you can't always see the blisters, if you are dating somebody and you don't get that paperwork, before you do it, you need to examine the area too. Make sure, if you see any old blistering residue or scarring from I don't know. Make sure you look down there before you do something.
All right. I have a question for you. My partner in crime.
Okay. Oh God, what are you gonna ask me?
Because you and I are always telling them what they need to do, what they should do, what they should do, and we don't never do.
We don't never.
So don't do what we do. Do what we say. Okay. So let me ask you, when the last time you got some paperwork on somebody? Okay. That's all I gotta say. Proceed.
I guess the paperwork, you understand? It may not be that paperwork. we get
She said, I make sure that their car registration is up to date.
License and registration, please. When's the last time you've been to the doctor? Do you have a PCP? Let me do an examination. Cough. Okay. Don't be asking me questions like that on camera because I can't lie to these good people.
They already know that we don't do half the stuff.
I do ask though, and depending on the reaction I get will depend on how I move forward. Okay, if I pass the P's, like I used to do. But I am asking. I do have all my paperwork up to date.
And you know what? One thing about Jasmine is she gonna pray through something.
I am.
I feel like the power of prayer is better than the license and registration.
Right. So I do pray that the blood of Jesus covers me as I commit my sins. So, and I ask for forgiveness of my sins afterwards.
Okay. All right. I just wanted to.
But yeah, most of the time paperwork is in order, and definitely the folks that approach me saying,
"Do you like your left nipple squeezed or your right nipple?"
Right. That's a no for me because how many other people have you asked this to? No, thank you.
Yeah. And that's such a turn off. Hi, my name is Gregory.
How you picking both of my brothers' names for these examples, though? That's what I need to understand. Because you said Jonathan before, and now you saying
today?
Yes.
Oh my God!
You're like, hi, my name is Jonathan. Do you want your nipples sucked?
Let me find out your brothers in the streets.
No comment.
Oh my God, I did choose.
You did. Look, what is that telling us something?
John and Greg, if y'all watching.
They ain't watching because, Also, just an honorable mention of a new
Yes.
STD that just hit the streets.
This is hot off the press.
The American streets in June of 2024. So in June of 2024, New York City reported the first case in the U.S. of an STI called TMV7. Actually, TM7, because that V is the Roman numeral.
That's the 5.
So it's, and don't get me. I was cursing here. I'm so sorry. Bleep that out, Jamie.
No, don't bleep it out. These people need to know how real we are.
Okay. Don't get me the line. I'm going to say this wrong. Trichophyton mentagrophyte type 7. That's serious. Which means it's not the first of its kind, because it's type 7. So where are the other 6 types? Anyway. The infection also... Right! Keep that over there. The infection... is a sexually transmitted form of ringworm. Can cause itchy red rashes on the genitals, buttocks, and the limbs. Do you understand? The patient that brought it over here was a man in his 30s, and he developed the infection after traveling to England, Greece, and California, where he said he had sex with multiple male partners. None of his partners reported similar symptoms.
He don't know his partners, y'all. That's why they didn't report him.
Yeah, I don't know what he was doing. Maybe he was out there smoking and drinking, and so he can't remember. TM7 is related to other fungi that cause conditions like jock itch and athlete's foot. Researchers caution that the rashes look different from the classic circular ringworm rash. Oh, God, if we didn't think we had all these other things to deal with, now we done added another fucking super ringworm to the list.
Imagine a ringworm in your twat.
STD Avengers.
Imagine
that. It can be treated with antifungals. So an antifungal pill can be effective at treating it. I do believe you can also treat it in patient with an antifungal intravenously. But yeah,
imagine getting admitted to the hospital because of sex.
I mean, I got admitted to the hospital because of sex when we had them babies, but
true.
You know, but for not something fun. Well, that ain't fun.
True.
It don't give you a baby at the end, though. I guess.
Is that a bad thing?
I don't know. The more I talked about it, the more I was saying, it ain't too bad if it's treatable. It doesn't sound fun, though.
No.
Sounds like it hurts, and it sounds like it looks bad.
Sounds like it hurts, it itches, and it's gonna make my skin crawl just to look at it.
Yeah. I don't even want to look at images. I'm not doing that. Get somebody else to do it. All right. So, as we said, some of these have symptoms before we go into prevention. Some of these have symptoms at their onset. Some of them, you don't have symptoms. So you would not know if you had, especially them cousins, chlamydia and gonorrhea. Sometimes you don't have any symptoms. You just going about your day, and, maybe you got pregnant and you had to get tested, and that's how you find out you got it. Or maybe somebody else slept with somebody else and they found out they had it, and then they have to notify you, and that's how you find out you got it. But it's not always going to come with the itching and the burning and the discharge and all those things. And that's why it's so important, though, to pay attention to your body. And if anything is abnormal, like if you're having discharge that's a different consistency or color, because it can just be that you have a watery discharge.
Yeah, some people just have it. And as your hormones fluctuate, your discharge can change.
Yeah. And you just need to pay attention to your body and go to the doctor if you need to get tested. There's other ways of testing too, which we'll get into, but pay attention to your body. You're not always going to have the symptoms. The person's not always going to have the symptoms. The only way to know is to get tested. That's why that is important. So, on to prevention. So just some personal tips that we have for you. Number one, for the guys out there, keep your dick in your pants, okay? Keep it in there until you know that you're cool, that you're good, right? To the ladies, close your legs, okay? Who is it that said close your legs to married men? It was one of them Real Housewives of Atlanta. I don't remember.
I don't know, but what I wanted to say when you said to the ladies, I wanted to say to all the ladies with style and grace.
Right. Well, the ladies with style and grace should already be keeping their legs closed. But everybody else, and also you ladies with style and grace, because you could also be busting it down and doing all that stuff too. Close your legs, all right? until you know that it's safe to open them. Again, do as I say, not as I do. God knows my heart. Use protection every time. Now we get it that protection is not always going to protect you against what we talked about earlier with the blisters and the herpes and this and the that, but use your protection. And I know we're not going to like hearing this, but that also goes for when you are performing oral sex. So
you want them to give some head with a condom?
That's how you're supposed to do it if you want to protect yourself. And honestly, all that getting stuff in your mouth and your throat, you're gonna get it. You're gonna get it.
She's not lying.
And for all you guys out there eating the cooch, you need to be using a dental dam, okay?
Sorry that I'm laughing.
I know, it's just like plastic wrap and all this, but that's really how it's supposed to be, because it can be transmitted in that way too. Have these conversations with your partner. So if you are planning on being intimate with someone, ask them, hey, when's the last time you were tested? When's the last time you had sex with someone else? And hopefully they will tell you the truth. And then if you can request to see that paperwork, request to see it. Make sure that they went to a reputable place and that the results are recent.
And say, hey, when's the last time you had an STD? And what was it? Was it curable? Was it treatable?
Right. And I mean, at that time, you would hope that they say to you, that they disclose, I do have herpes type 1, type 2, whatever it is. And then, you leave it up to you to make the decision whether they want to take that step with you.
But don't steal that choice from them. That's criminal.
It's criminal, and it's just wrong if you care about people, right? Misery does love company, though, and so some people do feel like if I gotta live with this and I like you and I want it bad enough, then I'm gonna just trick you into doing this, and we both gonna be having our best.
That's awful, but it's true.
Yeah. Also, there have been many advancements made throughout the years, and I know when it comes to HIV, you can take PrEP.
Yeah.
I'm not entirely sure what the letters stand for, but it is an acronym. But it's basically prophylactic antiretroviral medication that you can take so that if you are exposed to HIV, you won't get it. So that's cool. A lot of people that are in the community or that have occupations that expose them to HIV frequently are just on PrEP because it'll prevent them from getting it. Now, if you are exposed to HIV and you weren't on PrEP, you can actually take the antiretrovirals after. It's going to be a higher dose just to make sure that it can try to prevent you from getting it, and it's not 100%, but most of the time it does work, and it's a good treatment for if you've been exposed and you've been exposed or you think you have. You can also take what's called doxypep, and that can prevent you if you feel like you've been exposed to chlamydia or gonorrhea or syphilis, I believe. You can take that, and it's doxycycline to prevent those infections as well.
I'm sure it's probably a small window of people who feel like they may have been exposed to those 3 STDs.
Mm-hmm.
Excuse me. It's probably really small.
Yeah, that will actually care enough to be like, let me go get doxypep. Yeah. No, they're like.
Now, the HIV is something different, though, because if you're working with these types of patients, then you'll probably be like, oh my God, I was exposed.
Yeah.
Then that's probably utilized a little bit more.
Yep. Another thing that has come around recently, and this is not necessarily, well, it could be prevention because you're testing. So I feel like testing is a part of prevention as well.
Mm-hmm.
So in addition to going to your local clinic or Planned Parenthood, I know does testing.
Are they still open?
Yeah, for the most part, I think. I don't know. It's one of those in the month of Sundays, but You know, you can go there to get tested. You can go to your local Walgreens, CVS, and they sell kits there.
So does LabCorp and Quest.
Oh, okay. Where you can pick them up at the CVS, go home, do your little swabs or your finger pricks, whatever it is that you got to do. Send it off back to the lab, and then get your results. Now that part I would be scared about, but that's just me because I'm nervous.
You afraid of them having your DNA?
No, I'm just like, who's gonna call me with these results, and what are they? You know what I mean? Like, is it?
So I did. Excuse me. I did the COVID sputum test through the LabCorp mail before, and I had to register from my phone. When the results come in, it came straight to my phone.
Right, so they come straight to your phone, and you're just by yourself finding out that you got the fungus
the something type
TM7, right? And you find out on Friday night, and you can't talk to nobody till Monday morning. Now it done ruin your whole weekend because you got super sex ringworm.
It could have ruined your weekend, or it could have saved somebody that you was about to go bang.
So now you don't care because fuck it, you got it. I don't know. That's extreme, but
can I add two more to yours when you're done to the prevention?
Sure. So there are other at-home testing kits that you can order from different companies like My Lab Box, Everywell, and Let's Get Tested. Let's Get Checked.
Oh.
Let's Get Checked.
I'd have made a whole song to the wrong.
Right. There are costs associated with these kits, so just keep that in mind.
They don't take insurance?
I think the only place that takes insurance is Nurex, I think it's called. I don't know how it's pronounced. They're the only place that will potentially take your insurance. The other ones, I'm not entirely sure if. You'd have to look into that on your own. But these tests, you would order the kits online, pay for it to get shipped to your house. You follow the instructions properly, send the kits back, and then they'll report the results to you.
Okay.
What were you going to say?
My last two preventative measures to add here is don't sleep with every Tom, Dick, and Harry. It only takes one person. It does. But I feel like if you have like multiple sex partners, you're making yourself more susceptible to catching something. And it's harder to keep track. If you sleeping with somebody on Monday, somebody different on Wednesday, somebody different on Thursday and Friday, it's hard to keep track of who could have possibly given you this syphilis or whatever you're going to get.
Right.
So try not to sleep with every Tom, Dick, and Harry at the same time. Do it in moderation. Okay? Have a little self-respect.
Right. Do it on Monday and then on Friday.
I'm done. I'm so done with her. And then my last tip is for the skin-to-skin contact. What is that movie?
Where's Saran Wrap?
What is that movie where he was in a plastic bag? I want to say Boomerang, but
no, it was the Jamie Foxx was Booty Call.
Booty Call.
Oh my gosh.
Okay, so remember, girl, you so good with the movie,
right? And I had no business watching that at that time.
So remember Booty Call when he was in a plastic bag? Honestly, that's the only way for you to be safe is if somebody's in a plastic bag and you poke a little hole for the vaginal area and a little hole for the penis. Well, hopefully it's not a little hole for the penis. And then everything else is in plastic.
I'm done with you.
You gotta have on like a hazmat suit.
Yeah.
That's the only way to be safe.
Even then, who knows?
Because skin to skin contact, the friction, the back shots, the missionary, all of that, you can spread some of these STDs. It's a hard life.
Fun times. Yeah, because that ringworm sounds scary.
All right. Anything else we got for these folks?
Okay, so also important, and this episode was actually turning out longer than I thought it would. Here we are. All right. So you might ask yourself, okay, so I'm going to do all this testing. I'm going to ask for paperwork and all that stuff. But, we don't always make the best choices. So what is the best time to test for the different diseases? Because, it's not always like, oh, I just had the unsafe sex or the sex, whatever. Or maybe you were having safe sex and maybe stuff broke. That happens. You know what I'm saying? You're doing it a little too hard. these are the time frames in which it's the best time to test because it's given whatever the virus is time to marinate in your system. That didn't sound good.
But that's
Okay.
pretty much what it's doing.
Right.
It's cooking.
Because if you test before then, you may get a false negative. So in order to really accurately say, I have this or I don't have this, for chlamydia and gonorrhea, the window is 5 days to 2 weeks. So 5 days from the time of exposure to 2 weeks would be the time that the test is able to pick up on you having it. For syphilis, it's 1 to 3 months.
Oh, sure.
Don't know why that needs to marinate a little longer. Maybe it would need to be in a slow cooker. I don't know, child. For hepatitis A, which I don't think a lot of people talk about because I feel like there's a vaccine for it now, and so I don't know, child. No, that's Hep C. No, Hep A too, and Hep B. Yeah. 2 to 8 weeks. For Hep B, 1 to 9 weeks. For Hep C, 4 to 10 weeks. That's interesting. And how do they know this?
They're all different.
Right. For oral herpes, 2 to 6 weeks. For genital herpes, 2 to 6 weeks as well. For HIV, if you're having the antibody test, it's 23 to 90 days. And for the RNA test, so remember earlier I mentioned the 2 different types of tests, it's 10 to 33 days. So really, for both of these, what I've seen, 6 weeks is normal. And just to let y'all know, when you do go for an HIV test, they don't just run it through one time. They run it through several times just to ensure the accuracy of that test. That's just the protocol of the lab. Every lab that tests for this, they test your sample more than one time to definitively say you have this. And you'll usually see like either reactive or non-reactive. That's how you'll see the results for that. If you do get positive results, it's important that you notify your partners. Now, most states will require you to notify your partners and let them know, hey, I got tested, I tested positive. One of these services, I think the place is, it's either the Let's Get Checked or some other place, will STD check. That's another place that does the at-home kits. They will actually reach out to your partners, obviously after you give them the contact information, and send them a recorded message that says, hey, shit, I don't know.
Somebody that you slept with tested positive. Really?
And it'll be anonymous.
That's a good service. So then you don't know who gave it to you.
You don't.
Oh, that's a good service.
And it's just really so that they know that they need to now get treated.
Oh my God.
And they do it anonymously, and it's I was like, oh,
that could save somebody an ass whooping.
But can you imagine picking up your phone and getting a recording that's like, hey, you might have the Clemmy and the Ghani.
My mama's birthday.
7/28. Mm-hmm. Oh.
Now it's 29.
That you may have these things. Good luck with that. Click. Ruin your whole day.
Yeah, but that could save somebody from getting beat up because you know how ignorant some people are. You call them, be like, by the way, I have HIV. And they be like, I better not catch you in the street. You trying to get it?
Not by the way.
Whatever.
Not by the way.
Whatever.
Like, not how about them Knicks? Oh, by the way.
Yeah, so I think that's a wonderful service.
I do too. That sounds like a business.
It does. I mean, we could do that for people and not be on recording. I have a question for you. When you get your, let's say that the ER ask you for permission to do an HIV test, because, you know, they always ask you in there normally. Do you get your results back from them, or will the health department call you?
In the ER?
Mm-hmm.
I think you get them from them.
Okay.
Yeah.
Look at your dog.
You get them right there. Now, the health department does start to get involved when you have a case that needs to be reported, because that's how we get all these statistics about the top cities and the top states. Mm-hmm. And they have to get involved because you have to notify the people that you have been intimate with.
But that's the the duty of the doctor's office or the ER, right?
What, to notify
To
them?
notify them. The health department.
Yes. Yes. Another important thing, I know Kim mentioned it earlier, but after you get your positive, and then a lot of these places that do the kits will also arrange to have the treatment sent to your local pharmacy for you or sent to your house. So they're not just going to be like, you have chlamydia, good luck with that. Hope it goes away. Like, no, they're going to prescribe you with whatever antibiotic that you need. And then it's recommended that you get retested within a certain amount of time. So usually it's within 3 months. 3 months or 3 weeks? Don't give me the line.
For which test?
Chlamydia, gonorrhea. 1 to 3 months. Yeah, just to make sure that the treatment, went through your system. And please, if they tell you take 3 pills for 6 days, do that. Don't stop because you feel like, oh, my symptoms went away. Take it exactly as prescribed. Do not leave any pills left over because the shit won't go away. Take it as it's prescribed. Okay? And then get retested to make sure that it went away. And then everybody needs to get retested. And if you're going to continue to be with the person, you all need to get retested so that you're not passing this thing around. Okay?
And y'all need therapy because somebody out here cheating.
Somebody's out here cheating, or somebody, came into the situation with it. Who knows? It happens different ways. But you get retested so you can make sure that it went away with the treatment that you got. And then with the other ones, if it's something more life-changing and permanent, that's like treatable, not curable, there are a lot of programs out there for those with new diagnoses, for to get your medications as well as therapy to deal with such a diagnosis, because it is going to take a toll on your mental health. It just is. And if you act like it's not, then you really need to go to therapy, because you need to come to grips with the fact that it is a life-changing event, not only for your physical health, but also for the health of your future kids, your future partners, whatever it may be. It does change things. It's not as simple as having conversations about, how you want to grow old. Now it's like, do you want to grow old with herpes?
And also, it may not be your fault that you have it, but you need to do some self-reflecting. You need to try to see what you could have done differently. And you need to do that moving forward.
Yeah, I feel like a lot of people have some deep-seated issues as to why they make the decision. Yeah, why they make poor decisions, why they want to participate in risky behavior. And it typically stems from some childhood trauma that you had. And yeah, I mean, honestly, that's where it stems from. And so you want to get that in check. So going back to the mental health part, there's a reason why you don't want to make those good choices, why you want to take those risks. You might have ADHD. I don't know. Could be anything.
Could be.
Care for yourself.
All right, are we done? We talked about the rooter to the tutor today.
We did. We definitely did. Gonorrhea in your throat. I'm sure the other ones could be in your throat too. Haven't heard of it, but
HPV in your throat.
HPV in your throat.
I'm sure somebody out here swallowed a herpes or two.
That sounds chunky.
Chunky?
Yeah.
Yeah,
I think that's it. That's all I got on my notes. But yeah, close your legs and have some conversations, right? And get tested.
And not just pillow talk. Yeah. After it's said and
done.
Right.
Right.
Be like spooning. By the way.
Right.
You got herpes?
Yeah. No. Have those conversations beforehand.
And that was me looking behind me, y'all, because I said spooning. That's why I was looking that way.
Done. I'm done.
All right. Well, thank you guys for tuning in, and tune in next time for more snitching.
All right. Bye.